Stakeholders within South Africa's health sector recently appeared before the Competition Commission to offer submissions into the health market inquiries of public hearings. This with dialogue aiming to bridge the gap between private and public healthcare. CNBC Africa's Benedict filed this report for us.
The first round of the health market inquiry held by the Competition Commission recently concluded in Cape Town. Discussions focused on, amongst others, the high cost of private healthcare in South Africa.
One of the objectives of this inquiry is really to respond to the issue of high costs of private healthcare. We know, it is generally known that private healthcare is quite expensive in South Africa. So we hope that these hearings, including even submissions that have been received, would assist firstly in terms of making us understand what is driving up the cost of private healthcare services.
An independent panel, spearheaded by former Chief Justice Wandile, also had concerns relating to unfair practices and limited public awareness of various health services.
Another issue that has been interrogated is the issue of imperfect information. We've heard from consumers that they are not given adequate information, and because of that, they are unable to take informed decisions in terms of, for instance, which medical aid to join. So essentially, these are some of the key issues that have been raised and are being interrogated.
Government says private healthcare and certain medical schemes puts profit over people.
Let me give you the example. This patient was on a health plan, not a medical aid. Health plan which every morning after 8 o'clock is on TV. Oh, you're good paying, you get 6,000 rand a day, Now, this poor patient believed and did that. The patient needed neurosurgery because the cerebrospinal fluid path had blocked. And the health plan said, no, we want 50,000. We can only give you 50,000. When they advertise, they say, we give you 1,000 rand a day if you are in hospital. They said, no, you can go, we'll give you only 50,000. The private hospital said, no, we want 250,000. So there's a gap of 200,000 here. And they said this gap must be filled in by the patient. The patient, she must go and look for 200,000 rand. For the private hospital, because they said it's none of our business that the health plan will give you 50. And I was phoned, and we took this lady to Steve Biko Academy Hospital. The neurosurgeon did that operation. She's back home at work.
If you juxtapose what is happening with our constitution and section 27 of the constitution, which says health is a right, it becomes difficult if access to that right is market related. It then ceases to be a right, because you then have to have money in your pocket to access that right. So we need to work collectively as South Africans, create a system where health remains a right and the promises of the Constitution are realized. The market is about making money. That's what the market is about. And we do not want health being reduced to a market commodity like maize or cigarettes.
After receiving submissions, the Competition Commission will determine the outcome. The inquiry will continue within the coming weeks, with hearings to be held in Durban and Pretoria. Benedict, CNBC Africa, Cape Town.